Hi, I'm Fran Drescher, and all of us at Cancer Schmancer are so excited to bring you our Health and Wellness Masterclass, absolutely free. Do you ever wonder why you get sick? What causes cancer, and how you can reduce you and your family's risk? Well, we've put a lot of time, energy, and passion into bringing you the most cutting-edge information from amazing doctors who think outside of the box, leaders in health and wellness with a fresh perspective on what we can do for ourselves, options to consider when diagnosed, and new strategies to not only survive, but thrive. I have made improving our health my life's mission because I am a cancer survivor. But it took me 2 years and 8 doctors to get a proper diagnosis. Thank goodness I had a slow-growing cancer, or my outcome might not have been so good. Now I have turned my pain into purpose, so I'm committed to sharing everything I've learned with you. All the brilliant doctors and scientists I have met over my nearly 2 decades of survival. That's why I'm bringing you this master class, so you won't have to go through what I did. Watching this free health and wellness master class, I hope you will feel more empowered and less helpless, and walk away with a game plan. With 1 in 2 men and 1 in 3 women expected to get cancer, babies being born pre-polluted with 200 to 300 chemicals found in the umbilical cord, and kids predicted to not live as long as their parents for the first time in U.S. history, the time is now to take control of your body. I'm thrilled you're here, and I know it will make a difference. Now grab a pen and notepad, because we're about to blow your mind. Thank you so much for being a part of our journey of wellness. Now is our last but not least. This is going to blow your mind. Let me just get my papers, but I'm pretty sure I don't even need it because I love this guy and I know him personally, and we had the good fortune of him speaking last year. Okay, now this is going to wrap up our date. Okay, how many people know somebody that's had pancreatic cancer? And how many people that knew somebody that had pancreatic cancer passed away? Okay, so almost everybody kept their hands up. That's because most people die from pancreatic cancer. This guy is, I just love him. He's so amazing. He's a completely outside of the box, integrative medical doctor with his own hospitals. He's got 2 in Mexico. He's got a few in Europe. His name is Dr. Tony Jimenez. He understands cancer like few doctors you will ever meet in the conventional world. He knows how to beat cancer at its own game. He knows how to trick cancer with switching out nutrition. And he's going to come on and talk to us about his general ideas about it, but also and specifically, because we haven't really talked about this in depth, short of Matthew, who was so eloquent, on pancreatic cancer, but it's very pervasive. We're seeing more and more of it. People don't understand where it's coming from or how to heal it. And so and he's bringing a patient of his with, thank God, a happier ending than most people. So come on up. Please give a warm welcome to this brilliant Dr. Tony Jimenez.
Thank you so much.
Thank you. So why don't you sit right here in the center?
Can I stand?
Oh, yeah, sure.
And before we start,
yeah, are you doing a PowerPoint?
Yeah, we're doing a PowerPoint.
Okay.
But before
and then
we
you're
start,
going to bring out your patient?
Yes.
Okay.
But before I start, Fran.
Yes.
You know, in the booklet that we got coming in, you said something very powerful and you showed us. So maybe we all could do it. Let's all stand up, please, because we need a little break. And what does Fran say? Reduce your risk now. Let's all say it.
Reduce your risk now.
So thank you. Thank you, Fred.
All right, well, you do your thing.
Yes.
I'll just sit over here quietly.
So everything we've learned today, it's been a lot of information. I want to tell you a couple things. Number one is prevention is the name of the game. And, we'll talk a little bit about pancreatic cancer because Fran asked me to, so, we do what Fran says, right? In her event. And also, something that hasn't been mentioned too much, energy medicine. We heard a little bit about energy medicine when the neurosurgeon was talking about near-infrared light. And so at our clinic, Hope4Cancer, we do a lot of energy medicine. But when we use energy medicine to diagnose, it's okay. PET scans, MRI, CAT scans, ultrasounds, EKG, EEG. These are all energy devices that we're using to diagnose or to assess. But when we use energy medicine to treat, then we're quacks. And one of the reasons that I am in Mexico, I'm a US citizen, I'm a Mexican citizen, and I'm a Colombian citizen. I was born in Colombia, South America, is because south of the border, we can do the best for you. We don't have the laws that prohibit the doctor from honoring his Hippocratic oath, which is do the best for the patient without doing harm. First, do no harm. So this is why we are in Mexico. And maybe we'll have a little time for questions.
And you're a toxic-free hospital, right?
Yes, non-toxic. And we'll talk about the 7 key principles to cancer therapy because in 25 plus years of working with chronically ill cancer patients, I've developed the 7 key principles, and no matter what you do to prevent or to treat cancer, make sure that these 7 key principles are addressed. So maybe we could start the slides, please. In this world of darkness, there is light. In this world of fear, there is hope. Cancer is not a death sentence. You can recover, but you have to believe that. We had a patient that came to us and she said, Dr. Tony, I was given 6 months to live, and that was 5 months ago. So I have 1 month left. What can I do? What is the first thing that I'm going to do? Is change that mindset. Because no matter what we do, if that mindset is not shifted, the results will just not be there. So the attitude of victory, the mindset, and we'll talk a little bit more about that in a moment. For now, let's talk about pancreatic cancer. The pancreas is a gland that is hidden behind the stomach and in front of the spine. If we take our pinky and our thumb and put it together, and the 3 middle fingers we put together and straight, and then we put it right here under our ribs, that's where our pancreas is. And the pancreas is about 6 inches, so it's well protected by the ribs, by the stomach, by the spleen, and so it's hard sometimes to diagnose. Oftentimes, it's hard to diagnose pancreatic cancer in its initial stages. The pancreas has 2 main functions. On the left, you see what's called the endocrine function, and that's what releases insulin and glucagon by the cells called the islets of Langerhans. Insulin is to store sugar, and glucagon is to release sugar when the body needs the fight or flight. The other aspect of the pancreas is what's called the exocrine function, and that is the pancreatic enzymes that are released by these cells called acinar cells, and that is released into the small intestine, the duodenum, and these pancreatic enzyme-rich fluid helps in the digestion and the assimilation of foods and nutrients in the first part of the small intestine. Of course, in the first part of the small intestine is also where a lot of our immune system is. 75% of our immune system is in that, the gut health. So when you heard today about GALT, gut-associated lymphoid tissue, it's so important. All these concepts that you heard today, whether it's from the neurosurgeon or from the endocrinologist. I feel a little high after the last talk. Don't we all feel pretty good, right? And by the way, I take CBD every day. I think it's something that we need to take also for
Oh,
prevention.
you take it every
I do,
day?
yes.
And what
I
form?
take liquid under the tongue, hemp, because I travel a lot. Actually, after this, I'm going to Germany for Medicine Week in Baden-Baden, and so it's easy to travel with hemp CBD as opposed to cannabis CBD. Yeah. So, what else do we have?
How many times a day do you take?
Sorry?
How many times a day do you take?
I take it 2 or 3 times a day, yeah. But it's all individual, right? There's no protocols. I think that's one of the concepts we have to change in medicine is standardization and protocols. What's my protocol for this type of cancer? Have you ever treated leiomyosarcoma or glioblastoma? We're not treating the cancer, we're treating the person with the cancer, not the cancer in the person. And that's very important because once you work at the core features of a disease process, that's when you're going to get the best results. So for me, it's really not important the type of cancer because as you'll see later, the mechanisms of disease are the same. The core characteristics of cancer are the same for brain cancer, colon cancer, rectal cancer, breast cancer, all the types of cancers. So here we see some of the warning signs of possibly pancreatic problems that can be associated with pancreatic cancer. So jaundice, a yellow tint, right, to the white of the eye, mainly. Diabetes, sudden onset of uncontrolled glucose levels. Abdominal and lower back pain. Someone with pancreatic cancer, usually they refer the pain as they have a belt that's squeezing them, putting pressure. So that lower back abdominal type pain can be one of the signs of pancreatic cancer, pancreatitis, or some inflammation of organs in that area. Weight loss, nausea, vomiting, bloating, fatigue and weakness. Changes in the color of the urine, very important as well. Lack of appetite, and then changes in the stool, not only in the number, but also in the consistency and the quality of those bowel movements, okay? Any of you, please don't freak out if you think you have like 5 or 6 of this, right? You don't have pancreatic cancer, cancel clear that thought, but keep an eye, journal, and, if these symptoms don't get better, change your diet, do this, and go to a doctor that you trust.
Well, with the earliest, what I call the whisper stages of most cancers, and this one is not exempt, it can mimic far more benign problems. And that's why also often we don't get diagnosed in the earliest whisper stage, or we ourselves ignore those stages because it seems like we can and we're too busy to really pay attention to it. And what we want to do is pivot our thinking to observing, as the doctor says, ourselves. And if this is persistent and not really going away, check it out. Check it out. Better to rule out something that could be potentially life-threatening than, to ignore or assume it's something that ain't gonna kill you.
Right, and we know what assume means, right?
Yes, we do.
We know what
Yes, we
assume
do.
means, so it's better to be proactive. It's better to rule out the worst, as you just said, Fran. 86% of the patients that come to Hope4Cancer are in stage 4, and they fail conventional medicine. And most of them were either diagnosed late or they were given treatment options that they operated out of fear, and they were not able to make an intelligent, loving, caring decision as to their health. And who's in charge of our health? Ourselves, right? I cannot heal anyone. I could only heal myself. And as a physician, we're teachers, we're educators, so we need to give you that information, and you need to be empowered. And that's the beautiful job that you're doing with this session.
Hi, I'm really enjoying this Masterclass Health Summit. Aren't you? Because you subscribe to watch this free live stream of the Fran Drescher Masterclass Health Summit, we're offering you a very special price if you'd like to have this as part of your video collection or share it with your friends and family. It's a purchasable download, and I encourage you to get it because then you'll always have it for your immediate reference. All the wonderful information that these doctors are offering. So why don't you just click below if you're interested in purchasing a download of this wonderful 2017 Masterclass Health Summit, and it's a tax-deductible donation for Cancer Schmancer.
As we know, money or fame or connections and relationships couldn't save these two wonderful people, right? Steve Jobs, he had an endocrine-type tumor. Remember, that's the one that releases insulin and glucagon. And Patrick Swayze had the exocrine-type tumor that releases a digestive enzyme. And who here thinks that emotional or spiritual and emotional mental health is important to prevent and to cure cancer? Most of us, right? 99% of us. And the 1%, I think they're asleep, but it should be like 100, right? So we do a lot of work with the emotional conflicts, traumas, because we believe that if you cannot know it, claim it, and dump it. What is those deep, sudden emotional conflicts that we have? And for pancreatic cancer, if we could see the slide, please, it shows the conflicts, the traumas associated with pancreatic cancer. Conflict with family members, especially regarding inheritance. Lack or fear of lack. Lack is very important in pancreatic cancer. Disgrace, indigestible disgrace. Remember, the pancreas is to digest. Injustice, anger, and the money is going where it shouldn't, like taxes in my client's particular case. So this is very important because each cancer has an associated biological trauma or conflict.
And that's Chinese medicine teaches us that also.
Yes, it goes.
You'll say, oh, my liver's bothering me, and they'll right away hone in on exactly what your personality issue is.
Right. And when I was seeing, this and looking at Patrick Swayze and Steve Jobs, I think we all agree this is part of the unknown, because what did Steve Jobs do? He went all over he could to get the best physical treatment, but probably didn't address the emotional, mental, right? A quick story, because, we all like stories. If I have 11 minutes, so I better not say too many stories, but my mom, since I left home to go to college, I went to college in Dallas, every day I had to call my mom. The day I didn't call her, this is a Colombian Latino mom, she would say, son, you don't love me anymore. Why didn't you call me yesterday? Don't you know that I care for you and you're making me suffering? So it was always like, I'm happy calling my mom and she's saying this. So I was taking an emotional recall healing class, and the professor giving us this class, he asked me, Dr. Tony, tell me about your mom. So I told him what I just told you. And I was sitting down in the classroom, and my big right toe starts to hurt and throb. And I'm like, what's going on? So the class went on. That day, I limped to the hotel room. I couldn't put pressure on my right foot. And so finally I got to the room, some friends put ice, they put essential oils, and it was a bad night. I mean, really bad. I couldn't sleep well. In the morning, it was maybe about 20% better, but I was still noticeably limping, and the professor said, did anyone have an experience last night after the class, any dream? So I kind of raised my hand. I told him what happened with my big toe, and he said, open your workbook to page 16. And read the conflict associated with the big toe. And so I opened the workbook, and it says, conflicts associated with the obligation to do as your mother says.
Wow.
And so then I looked at the second toe and little toe and all that, and it was like sister or brother or uncle, right? And so he helped me let go of this trauma that I had with my mom. And guess what? By the time that class was over, I was okay. I was jumping fine, and a friend there that's a trauma guy, he said, Tony, you can't be doing that. You have an injury. And I said, well, it's fine. The interesting thing is I never told my mom this story. And guess what happened? She changed. I haven't called her in a week. And next time I call her, she'll be different. Right? So I don't know how all that works. I don't understand it, but it's universal, the universal energy that we all share, right? So she got it, I'm healed, and now I don't feel burdened to have to call my mom every day.
Now,
No,
I'm
go
sorry.
ahead.
Okay, because I want you to bring your patient out who's, a survivor, thank God. And I also want you to just very quickly touch on some of those, daily practices that you recommend, like, something that I believe in, coffee enemas, and, you have a special potion of daily vitamins that's an amalgam of what? And all the other things that you think should be part of everybody's daily practice.
Okay, let me put a slide up there, and that will be a good visual for you. And I will go through the slides, but it's basically on the 7 key principles. This is all statistics on colon cancer. Pancreatic cancer is the 4th leading cause of death from cancer in the U.S.
Wow.
After lung, colorectal, and breast.
Do you attribute that to all the processed sugars?
Well, processed sugar, emotional conflicts, toxins, and everything that we've heard today. Right? We are getting more and more patients every day with pancreatic cancer. If you look at this slide, most of the times, 52% of the times that the pancreatic cancer is diagnosed, it's already spread somewhere to a distant organ, either the liver or lymph nodes or the lungs. So the opportune diagnosis is not really happening. They're finding this when it's either in stage 3 or 4 for the majority of the cases, when it's away from the pancreas itself. We, as you see here, 7% of our total patients are pancreatic cancer. It's a little bit higher than what is seen in the general population, is 5 to 6%. So the fact is that there is an increased number of pancreatic cases being seen now. As you know, chemo, surgery, radiation is the thing of choice, right?
That Whipple?
That Whipple. Here's the Whipple, the most aggressive surgery that there is. And actually, I'm going to introduce very shortly Rivi, and I'll mention her story briefly. But I want to answer your question. We were blessed to have the 7 key principles of cancer therapy published in a peer-reviewed journal out of UCLA.
Peer-reviewed journal.
Out of UCLA, so they accepted. As we said, we're talking outside the box, and from such a major institution to accept this publication, it was quite a blessing. And these are the hallmarks of cancer that are inherent to all cancer types. So those of you taking pictures, you could review them, but it's too much to say now. But the point is that all cancers have the same characteristics. So we're not treating the cancer type, we're treating the characteristics, the hallmarks of cancer. And here's the key, the 7 key principles to cancer therapy. And no matter what you do, I believe in so many years of working in cancer that these 7 areas must be addressed for you to have the best opportunity to recover from cancer. And 6 of these relate to all of us: prevention, reducing our risk now, right? And so nutrition, we could spend hours on nutrition. I just want to give you 2 comments about nutrition. Rotate your diets. Every 3 to 4 months, slightly vary your diet, because cancer cells can adapt and do adapt to a specific diet program. So many times we have patients that are on ketogenic, vegan, paleo, whatever the diet is, and their cancer is okay, and all of a sudden it begins to rise. So rotate the diet, because these cancer cells, I beg to differ with a doctor that said that, with all due respect, I don't think cancer is a dumb disease. I don't think it's stupid. I think it's very intelligent, because it's surviving, it's adapting. Out of the University of Iowa, there was publications about the intelligence of cancer. They're exhibiting social behavior. They are changing. They are protecting their DNA. They're secreting a lasso like a rope that's grabbing on nearby healthy cells. So for me, I say I'm a simple guy from a small village, it's a smart disease process that has been able to adapt, have been able to survive, and every day since the war on cancer, back when Nixon, it's killing more people, the incidence are higher, and yes, we could say it's because of epigenetics and environmental thing. However, the fact is that, we need to change all these things, and these 7 key principles are key here. So nutrition, optimize the immune system. Cancer cells have found a way to shield or cloak themselves from being seen by the immune system. So it's not only important to have an optimal immune system, but for the immune system to detect and see those cancer cells. Detoxification, we know, starts from the thoughts. A negative thought can kill you faster than a bad germ. Right? So we have to detox the thoughts, the mind, the mouth. We heard about that. All of our patients see a biological dentist. Eliminate pathogens, the emotional, spiritual, oxygenation. We're shallow breathers. This was great to start off with, the breath, right? Because life is in the breath. Life is energy. Life is light. And so we need to go back to nature, as we said before. And non-toxic cancer therapies. And to answer your question, Fran, coffee enemas, IV vitamin C. It was recently proven at a Stanford University in the UK that vitamin C kills cancer stem cells. Has anyone heard about cancer stem cells? Yeah, so if you have a tumor or a lymph node, 99% of those cells are non-cancer stem cells. They will die with chemo and radiation. 1% are cancer stem cells. Those are resistant to chemo, resistant to radiation. Those are the ones that metastasize.
And they don't show up on a
No,
PET
they
scan
don't
when
show
the
up.
doctor says you're
Yeah.
cancer-free. I always
Right.
roll my eyes when people say that because those floaters
That's right.
can't be picked up on a PET scan.
So the test
Is
to
that
do-
the T cell?
That's the circulating tumor cell, CTC.
Okay.
CTC, and that's a blood test done at Cell Search Lab in the US or Main Track Lab in Germany. Excellent to detect circulating tumor cells. So if you were told you were in remission, I don't believe in relapse or reoccurrence. The cancer cannot come back like it did in Revi in 3 months from nowhere.
Right.
When she had the surgery, and I'll say briefly, Revi, when she had the surgery and they told her it was free, this was at Cedars-Sinai, we got it all. How many times have we heard we got it all? When cancer is diagnosed, there's already 1 billion cancer cells in the body somewhere. So this is one of our patients with a neuroendocrine cancer. She lives in somewhere here in Southern California. August 2015, and she's doing very well. And then Revi with stage 4 pancreatic bile duct cancer, diagnosed December 2012. So she's going on her 5th year. I want to show her last MRI, which was just a couple months ago, August 2017. No evidence for recurrent or metastatic disease. So this is the hero. It's not the doctors, it's the patients.
I'm so glad that we're watching the Fran Drescher Masterclass Health Summit together. Thank you so much for subscribing. Isn't it great? I can't wait to go back and watch more. But I just wanted to tell you that on October 23rd, we are going to be doing the Fran Drescher Masterclass Health Summit 2018. And it's going to be more exciting and better than ever. You can click below or go to cancerschmancer.org and get your tickets or watch us live streaming for free on October 23rd. But if you come in person, you'll get to meet me and some of these wonderful doctors that I promised you will rock your world.
So Revi, why don't you please share your story, your journey with us?
Hi, welcome.
Thank you for having me.
Thank you for being here. Come sit down over here. And can you tell us your story a little bit quickly?
Sure. First thing I have to tell you is that I have an accent.
Really? I didn't.
I always tell people, because I speak in public a lot, that it is indeed English I'm speaking. So it will take you 2 minutes maybe. but you should be able to understand it. Okay, so I know we are short in time, so just to do it quickly, it was 2012, and it was the month of November, and I was on a trip in Israel, and I became as yellow as I could be, right? And then, I will ask people, am I yellow? Am I yellow? And they tell me it's the lights. I was very yellow. I was totally jaundiced. I came back home, and I went to the doctor, and sure enough, I had bile duct pancreatitis, cancer. But they didn't tell me this immediately. They just told me I have cancer and I have to have operation as soon as possible. And they suggested I'll have the Whipple procedure, which, as you have heard, it's one of the most complicated operations known to mankind.
It's the most invasive oncological surgery.
Right. So then I went, and they also told me that they thought it was content, but if it's not, then they're going to just shut me off and goodbye. They won't finish the operation. So the first test was to pass those 2 hours of operation to know that I'm actually in their operation and I have a chance. And so I was 10.5 hours in this operation, and they took out part of my liver, part of my pancreas, the bile duct, the gallbladder, part of my intestines. And then they plumb me all together back one way or another, okay? It works. That's what's important. So, and after that, it took me a long time to recover. I was almost a month in the hospital, and they told me that they took everything out, just like you heard, and I don't have it anymore, except they took 9 lymph nodes out, and 8 of them were clean, and 1 of them was contaminated. So they told me that I have to do chemotherapy and radiation. Well, I had an aversion, something against chemotherapy and radiation years before I got cancer. And so I decided, no, I'm not doing it. So I told them no. I went home. I was like 3.5 months on a lazy chair because I could not even sleep after that operation. And then I went and did an MRI to just a follow-up. And sure enough, I metastasized. I had 2 tumors now in my liver, right? During the time, and I have to go back 1 minute. During the time, as soon as we heard that I have cancer, we knew that we have to change our life. And that was a drastic change. There was no thinking about it. It was doing it, and that's it. That was life. And so we cleaned all the house, even before I came from the hospital back home, from all the toxins, from all the chemicals. Everything went out, everything. And we replaced it with natural products. The same with the cosmetics and all the toiletries, shampoos and conditioners, you name it. Everything had to go. And then we changed our diet. We became vegetarians, only organic. All the sugar went out the window. Nothing like that anymore. And we even started eating raw and juicing. And yet, despite of all of this, 3.5 months later, I had metastasis, okay? But during the time, we also realized that we might need something more aggressive because, pancreatic cancer is a death verdict. So we started to research also different clinics and different possibilities.
This was after it had metastasized?
Before I metastasized.
Before?
Yeah, but when my daughter had to tell me that, I have metastasis now, at that point, we decided, okay, we have to find a place because what we're doing is not aggressive enough. We need a stronger treatment. And so we found in Mexico several clinics, and we went on a pilot trip of 2 days and checked them out. And two of them was out of the question. And you hear so many things about it. You don't know what's true, what's not true, who you can trust, who you cannot trust. So the third clinic was the Hope4Cancer. And we went there, and I spent, 2-3 hours with you, asking him all the questions in the world that I could have think about. And Dr. Tony was very nice. He explained everything with tablets on the board, okay? And, it became very clear to me that this is the place to go, because they had a follow-up program, for instance, and I was thinking, I'll go. 2 weeks later, I'll be at home, and what do I do now, right? So that was very important. And then I already knew some of the treatments that I wanted. I wanted a high-dosage IV of vitamin C's, and I wanted the hypothermia and some other things, and not all the clinics offer it. When I came to the Hope4Cancer, they offered all the things I was looking for, plus more, things I didn't know about, right? So we decided to go. Dr. Tony suggested 2 weeks, and when I came in there, just like anybody else, they tested me. And one of the things they test is to see the blood activity around the tumor, right? I don't know how much you're familiar with it, but cancerous tumors grow their own blood activities because they want the nourishment, right? So they tested me when I came in. They tested me when I left 2 weeks later. And I had 60% reduction in the blood activity around my tumors. I was stage 4, yes, 2 tumors. And in 2 weeks, I had 60% reduction. And yeah.
Yeah, you did it. You did it.
You did it. But we both did it.
Now, can I just ask a question? The fact that she had turned down the chemo radiation, did that help you exponentially to save her because her body wasn't further poisoned and damaged?
Yes, for a couple reasons, and the answer is yes. First is that when someone has chemo and radiation, those circulating tumor cells, those cancer stem cells, are more active and more aggressive. Secondly, the cell health, cell integrity, and cell function is decreased. We know that cells are the basic unit of life. They're the foundation. They make tissues, and they make organs, they make systems like the immune system, the digestive system, and then all these systems make up the body. When someone has chemotherapy radiation, they're treating the end organ. They're not treating where disease starts, which is at the cell level. And so if someone does not have chemo and radiation, they're at least 5-6 months ahead of the curve for those patients who did have chemo or radiation.
So that's important to know, because when you travel down that path, if you're thinking at all about going alternative or integrative, you might be putting yourself at a disadvantage for your body to responding to a more holistic approach.
Yeah. And if I could say, Fran, I'm a medical doctor, I'm a naturopath doctor. I know this, and I know the natural ways, and I know the conventional. I was trained in this. And it's not that I'm against chemo or radiation or surgery. There are some times where you have to use these tools. But always, always with the integration. You might say, when do I need chemo? When do I need chemo? Well, if you have leukemia and your white blood cells are so high, you need to have chemo right away. If you have a big tumor in the neck that's blocking the blood flow to the brain, or tongue cancer, throat cancer, we give low-dose chemo. There's a technique called insulin potentiation therapy. Anyone heard of that? Low-dose chemo, right? So we could give 30% of the conventional dose of chemo. Patients don't lose their hair, they're not sick in bed, they're not vomiting, they don't have diarrhea. So the purpose of that type chemo is not an ends to a means, it's just part of to get that tumor reduction as quick as possible while you're working on the juicing and the detoxing and the immune system and so forth.
So how many years, are you since going to the doctor?
Well, I'm almost on 5 years. Okay,
Oh,
since
that's
my
fantastic.
diagnosis, it's 5 years.
Wow,
But
that's great.
since I was clean, what happened is that after the first reduction, I came back to the clinic a month later for a follow-up, and I had an additional reduction of 40% of the blood vessels, or the blood activity that were left after the first reduction. Within 4 months, they could not find my tumors.
And they, meaning here at Cedars-Sinai, not us. She
Yeah.
had independent studies here
Yeah.
at Cedars-Sinai, and guess what they told her? They said, we made a mistake. The head of, the cancer liver specialist who did the liver biopsy and confirmed it was biopsy, he said, isn't that true, Reva? He said, I made a mistake. You didn't, the biopsy was wrong. How could that be wrong?
My surgeon,
Your surgeon.
who is a real big shot there, a wonderful person.
So rather than admit that the technique worked, they'd rather say that you really didn't have it.
Well, he didn't tell me I didn't have it. What he said to the lab, because he got the result back from the lab that I'm clean, he said to the lab, you cannot, your test is not good. Cancer, he said, cancer does not go away. Maybe it will shrink, but it won't go away. So if you cannot see it in the lab, then something wrong with your machines or something wrong with your
Now,
test.
are you diligently practicing Dr. Jimenez's program to this day?
Well, for a long time, I did just that. Okay, but yeah.
Reva is an interesting patient. She's also a Bible scholar, and she's very intellectual, and sometimes, I don't think anyone is perfect in following a treatment program, but she has the mindset, she has the spiritual strength, and she has Tova, her daughter that's here, who it pushes her, but she has something. She has that uniqueness about maybe not following a diet or a nutrition program 100%, but it's okay, because it's what we do most of the time that counts, not what we do some of the time.
Yeah, for a long time, I followed almost to the letter. But now I'm a little bit, things change now. Okay?
Yeah, you cheat a little here and there.
Yeah, but I'm still
Your
holding.
mindset and, your connection to your body is on high alert. You
Exactly.
know what you're doing every step of the way.
Exactly, and what I have to say also is that, they gave me 6 months to live maximum. When they found out the 2 tumors, they said 6 months, no more, because I refused to do chemotherapy and radiation again. Well, within 4 months, out of these 6 months, I was totally healed.
Healed. That's fantastic. I'm going to have to call it close to this panel, but I have to say this has been a beautiful way to end, because you, sir, are the amalgam of everything that we've been talking about, and it's just so wonderful that people here today got to experience you and your story. So thank you so much. Thank you.
Thank you,
And
friend.
thank
God
you.
bless.
Thank you. Thank you
Thank
so
you.
much, and safe travels
Thank you.
tonight.
Thank you for having us. God
So,
bless everyone. The
thank
power
you.
to heal is in you. And believe there's hope. I am hope. You are hope. And we are hope. Share
That's
that
right.
message to the world. Thank you.
Hi, it's me, your host, Fran Drescher. Thank you so much for watching. Wasn't that great? Now you have some tools to stay healthy and prevent disease, as well as fresh options to consider if, God forbid, you are sick. Cancer Schmancer's mission is to educate you and your loved ones on how to transform from patient into medical consumer. If you enjoyed this, if you learned something, if you want to know more, then please make sure you watch Fran Drescher's Health and Wellness Masterclass 2018, live streaming free on October 23rd at cancerschmancer.org. Please help us get this life-changing information out to as many people as possible, so together we can all move into a healthier world. Share this with your friends and family. It's 100% free, so there's no downside. Remember, each one teach one. Please visit cancerschmancer.org to learn about our life-saving programs like Fran Vans, offering low-income women free mammograms, and Be the Change program, targeting teens and tweens on staying healthy by checking labels, choosing safer products, and becoming the change the 21st century desperately needs. So happy that we had this time together, and so grateful for your helping to spread the word so we can empower more people like yourself to crack the code on sickness. I love you. My prayers are for you to be well and have love and peace in your hearts. Thank you so much for watching our Masterclass Health Summit. If you make a tax-deductible donation to Cancer Schmancer now and purchase the entire series download, we'll give you a special 10th episode as a thank you. Because mind, body, and spirit balance is so important, this bonus is led by my personal shaman, Russell Feingold. Click the link on this page to make your donation and start downloading now. Thank you.